Welcome to the second part of the Antiparkinsonian drugs talk. Today we're going to have a closer look at all those medications. The first representative is levodopa-benserazide combination, well known by the name of Madapa. Madapa comes in conventional release tablets and capsules that are practically the same. Initially, it is taken 2 to 3 times a day with a maximum dose of 2 grams a day. Capsules can't be opened. Many of our patients will develop swallowing difficulties, especially later as the disease progresses, and may not be able to swallow capsules. So tablets can be very handy as they can be broken across the scoring line. Madapa also comes in rapid dispersible tablets. Patients may benefit from taking this form before their meal times or when they just wake up to enable movements faster. HBS capsules is a clever dosage form. HBF stands for hydrodynamically balanced system. It floats in the stomach and releases the drug slowly. It can be very helpful when the longer duration of action is required, for example at night time. Levodopa and carbidopa combination comes in Cinemetinase generics, immediate release and controlled release tablets, and Kinsan tablets. There is also an option of duodopa intestinal gel. It is important to note that controlled release tablets should not be broken in half, but it's okay to have all the scored tablets. Levodopa, carbidopa, and entacapone combination or Staliva is the third option containing levodopa. It is worth mentioning that there are a number of different strengths of levodopa, but the content of entacapone is always the same, 200 milligrams. It is important not to break those tablets, as if the patient takes less than 200 milligrams of entacapone, the medication may fail to work. Most patients receiving treatment with levodopa will develop dyskinesia, out-of-control movements 5 to 10 years after the start of treatment with levodopa. Levodopa may also increase the risk of worsening of peptic ulcer disease, cardiovascular disease, and psychiatric disorders. Entacapone also comes on its own as Comtan 200 mg tablets. A fun fact about entacapone, it turns urine a reddish-brown color. It often causes dizziness and sedation through increasing the availability of levodopa. It is taken together with levodopa up to 2 grams a day. Pramipixole is our Cifrol and its generics. There is an immediate release and extended release tablet. Immediate release tablets are taken 3 times a day and the controlled release formulation just once a day before going to bed. As mentioned in the first part of our talk, if you want to convert from one form to another, use the same total daily dose. Dopamine agonists in general are not well tolerated. They often cause nausea, drowsiness, and even sudden sleep onset, which could be dangerous if the patient is still driving. They are also not as easy to stop, with some patients developing severe withdrawal symptoms lasting days or even years. Some patients are also prone to develop hallucinations, especially elderly people. Impulse control disorder, where people start engaging in risky behaviors like gambling and inappropriate sexual behaviors, is a well-known side effect of this class of medication. Ratigatin comes in Nupra patches of various strength. It's advised not to cut patches, but a few patches can be used at the same time to make up a desirable daily dose. MAO-B inhibitors, selegiline, razagiline, and sulfonamide come in tablet forms. Interestingly, selegiline, Aldepril tablet, can be administered twice a day, but it is recommended to give it in the morning and at midday, not breakfast dinner as the majority of BD drugs. Razagiline, Azelect, and sulfonamide, Xadaga, are taken once a day only. When MAO-B inhibitors are taken without MAO-A inhibitors, there is no need to follow a tyramine diet, but watch out for serotonin toxicity when combined with a number of psychotropic medications. Amantadine, it's our Simitrel, is available as 100 mg capsules and can be taken 3 times a day. In older patients over 65-year-old, only 1 capsule a day should be prescribed. Apart from relieving the majority of mild symptoms of Parkinson's disease, this medication is quite effective for tremor. There are 2 representatives of anticholinergics for the treatment of Parkinson's disease: benztropine, benstrop tablets or injection, and trihexyphenidyl, Artane tablets. These drugs are used only for tremor and often cause a lot of anticholinergic adverse effects, such as constipation, dry mouth, urinary retention, cognitive impairment, and so on. They are also not easy to stop due to risk of anticholinergic crisis and potential worsening of Parkinson's disease. They are not effective for treatment of any other symptoms of Parkinson's disease. Thank you so much for listening. I hope you enjoyed the recap.